Hello friends, I'm Dr. Aastha Gupta from Delhi IVF and Fertility Center, and today we will briefly talk about the most difficult thing that we face when we do IVF, and that is IVF failure, right? So I'm going to talk from a patient's perspective that how do we feel and what we are going to do when we face IVF failure. So of course, for any woman, in fact for the couple, it's a huge thing because we prepare for our IVF mentally, physically, financially. We talk in our families. We are already stressed because we are going through infertility. Then there is a long list of consultations, ultrasounds, so many injections, pain also to some extent that we go through. And we are really expecting that, I'm going to get the best news and get pregnant. And there we go, the IVF fails. So as a doctor, I want to tell you that, we understand this situation, and it is a very scientific thing that IVF is not 100% success. So how are we going to deal with a failure? What are we going to do? And of course, how are we going to address our feelings? So my most important thing is for all the couples out there is that don't get defeated. Don't feel defeated. Don't feel it's the end of the world, because scientifically we have to understand that if this is an advancement in science and we end up, there is advancement in science and there is a 40 to 50% chance of success, there is also some failure because it is not 100% science. So when we understand that, and with that open mind we go and visit our doctor, the doctor will be able to see our case, do the investigations, even a more thorough checkup, and explain to us why it failed. In many cases, we are able to point out and we can tell you what are the probable causes of why the IVF failed. It could be a failure in the implantation of the embryos. It could be a poor uterine cavity. It could be a poor sperm. It could be a subnormal or an abnormal egg quality. So my point of today is to really tell you that don't get disheartened, but take it in your stride that okay, this is a scientific process and there is a process to it. It's not like once it has failed, so we have failed, but to take it very courageously in a positive way and go back and discuss with your doctor. Also now with the advancement, like when we started out at Delhi IVF 29 years ago, the IVF success rate was 5%, which was very, very low, and now it ranges from case to case between 40 to 60%. So there is a huge advancement in technology. There are so many new research breakthroughs which are happening every day all over the world. So most doctors and good doctors, experienced doctors, are at par with what new is happening in this field, what new we can do. So now no more the science is like that okay, once the IVF is failed and we are, done for our life and we can never have a baby. The idea is to go back, have that courage and explain and discuss your case with the doctor and understand what are the next steps that we have to do. It's a project and all. It's not like a one-time thing. So that's my only appeal, that don't get disheartened. Go back and discuss, see what else can be done, and pursue this project till you can have your baby, till you actually end up having your baby, because that's our logo, that's our motto, that if you have a desire, you can have a baby. Today, science and technology is advanced to such an extent that if you have a desire in your heart to have a baby, you will in fact have a baby. That's our conviction, and that's how much science has progressed. The only thing it takes is little bit of patience, little bit of understanding, and little bit of courage. And I can promise you that when you are on the other side of it, when you become parents, when you have the joy of having your baby, you will forget everything. You'll forget the struggle that you went through it, because that precious baby will be in your hand. So that's my thing for today, and we'll meet again. Thank you.